introduce herself, because she is a eminent speaker and has been associated with this life-saving movement. Even, in fact, she is the driving force behind this life-saving movement. And she's also an instructor from American Heart Association for ACLS, BLS, which is basic life-saving support. And in the next 45 minutes, we'll be learning from her about the CPR process, how to save a life, and what is the basic difference between heart attack and cardiac arrest. Generally, we people tend to get confused between these two things, and there's a very fine line between it, which I'm sure we all will be able to know better once by the end of the session. And this session will continue for an hour, and we'll have 40 to 45 minutes of lecture demonstration, and 15 minutes we'll have for the interaction and questions. So that is all, and I welcome Dr. Shruti and each one of you to this webinar today. So over to you, Dr. Shruti.
Thank you so much, Shruti. Thanks a lot. Both of us are Shrutis today. That's really wonderful. So thank you so much for this wonderful introduction. Shruti herself is the director at Value Life Foundation, and we are doing this together because we have a common, common goal, common cause, and a common calling in life, that is the life-saving movement. We believe in, teaching people, empowering people with the skills that are helpful in saving anybody's and everybody's life. Now, like Shruti said, I am an anesthesiologist by profession. So I want to know how many of you know what an anesthesiologist does. Okay, so this is initially, to begin with, this is going to be an interactive session. So if you can have your videos on, that would be lovely. So it wouldn't feel like I'm speaking to the screen. So if you're comfortable leaving your videos on, you're most welcome to do that. And if you're not, then you can actually use your, there's a emoticon bar with Zoom videos underneath your, that bar that you get. So you can use thumbs up, you can use smileys, you can use claps, you can use whatever emoticons that you are given below to give me feedback, so that it's an interactive session. It doesn't feel like a lecture or a theory, because this entire session is going to be interactive. So before I begin with, everybody is okay with English, or you want to speak, you want me to speak Hindi and English? Anybody? Everybody's comfortable with English? Yes. If not, you can unmute yourselves and let me know.
Yes, Madam, English Hindi ठीक रहेगा.
Fine.
अच्छा ठीक है, all right. So Hindi, English is okay. सबके लिए. Anybody who doesn't understand Hindi at all? Is there someone who does not? Because we have participants all over the country. तो पार्टिसिपेशन पूरा इंडिया में से है, तो ऐसे कोई है जिसे हिंदी बिल्कुल समझ नहीं आती? Anybody doesn't understand?
Nevia is there. She won't be able to follow Hindi much. Nevia.
Okay, all right.
And
okay.
Dr. Snehalata as well. So I think we can have
right.
more of Hindi and
Hindi, English. So anybody who doesn't understand, okay, we are getting Dr. Snehalata, Nevia, Nandini. Okay, everybody wants English. All right, so I think we'll keep a majority of English. अगर किसी को समझ नहीं आता है, तो please raise your hand. There's a raise your hand option in your emoticon below, or you can leave your videos on so that I can actually see. मैं देख सकती हूँ आपको, or I can stop and explain the thing to you. And we'll be taking 15 minutes of questions at the end of the session. We'll be having a question answer session at the end, so we can always take. अगर कुछ समझ नहीं आता है, तो in the end we'll take it. Yeah, Mr. Ravindra, you've raised your hand. Mr. Shenoy, you want to say something? You were just testing the raise your hand option. All right. So you like anything, you understand, you give me a thumbs up. You don't understand anything, you give me a hands down. Tejasvi, you've raised your hand. Yeah, tell me.
Nice to know you're from San Hospital. I'm Masters in Occupational Therapy, UG
Hello.
also, PG also from San.
Hello. Nice to know that. Thank you.
So it's a very nice thing, and I was looking forward for it. So congratulations, and I will
Same
be
here.
interactive. As an organizer myself, I understand the importance of the interaction. So I'll definitely ask you questions.
Thank you so much. Thank you. So this has always been a real time thing. You know, we have always done this offline. So this is a skill based training program which we're making it available online only because of COVID. So a lot of bad things have happened due to COVID, but a few good things also. This is now available online to all of you. So anyone and everyone, you're welcome to leave your videos on. All right. So and everybody's here to learn. So the more answers I get, the more interaction we can have. Now, can we start? All of you
Yes,
ready? As excited as we are to take the session? Yeah?
Yes, ma'am.
All right. Okay, you can give me thumbs up, all of you. Okay, if you give me a thumbs up, I can actually see that here. All right. Okay. So
Great.
raising your hand would mean asking questions. Tejasvi, you can give me a thumbs up. All
Yes.
right. That's Zoom language for COVID times.
Correct.
Okay. All right. So starting with the first question, what are the 4 life-threatening emergencies that you know about? So you can copy, it's already given there. You can copy the answer. So the 4 major life-threatening emergencies that any adult or even a child for that matter can come across is, except barring stroke, I think heart attack, cardiac arrest and choking is something that is universal. Now there is no gender bias, there's no age bias. Anyone and everyone is documented to have gone through these things. Out of these 4, we're going to discuss heart attack and cardiac arrest today. And cardiac arrest, like my last line in the PPT, everybody can see the PPT, right?
Yes.
Yes. Okay. So cardiac arrest is going to be the ultimate medical emergency, and we'll see that. We'll see why in some time. Okay. So beginning with, how many of you know that heart attack or the cardiac arrest are 2 different things? How many of you knew that?
You can unmute yourself and give the answers. It will be really nice to hear you all.
Cardiac arrest is a sudden arrest.
Okay.
I think one is a sudden cardiac arrest.
So cardiac arrest is also called a sudden cardiac arrest. Yes, it's called SCA. And if that arrest is not treated with CPR, it becomes a sudden cardiac death. It progresses into sudden cardiac death.
Right.
So what is a heart attack then? Anyone?
Heart attack, I think, is painful. You know, you get chest pain or something.
Yes,
and
very good.
Then
Symptoms.
that's an indication. You get an indication for that you are going to have trouble.
Very good. Excellent. Excellent. Anyone else who wants to add to this?
So there are subjective symptoms. The person feels that there is something wrong.
Very good. And who tells you this? Who tells you this? You know, so as a first aider, when you're looking at, so you want to help someone, right? So you come to know that this person is having heart attack, or that person tells you?
So mostly you see how if it's a pain, if it is radiating in the arm, then you realize that, and the person is also able to show you if there are some signs like that.
Mostly, I think the person will tell you.
Fabulous, Mr. Mehta. Correct. Absolutely.
Mostly the person will tell you he's having a problem, he or she's having a problem.
Yes, the person who's having a heart attack will realize something is wrong. So what is the difference between heart attack and cardiac arrest? This picture, this PPT picture that I've shown you pretty much summarizes what it is. A heart attack victim will have symptoms, signs and everything, and the cardiac arrest victim will be lying down. So we'll see what each of these are. Heart attack generally is also called as myocardial infarction by physicians and doctors. Okay, so physicians and doctors, they will call it MI or AMI, acute MI. So it's called myocardial infarction also. So if we hear anyone talking about MIs, they are talking about a heart attack. A heart attack is generally a plumbing problem. You know, the plumbing thing, pipes choke up ho jate hain, pani jata nahi hai, right? So heart attack generally plumbing problem. It's a plumbing problem because the arteries or the blood vessels which carry the blood to the heart. The heart is a working muscle, right? It pumps blood to the entire body, correct? So we were taking this session with school children, I think 7th grade or 8th grade, and I had asked this question to them: what is the function of the heart? What is the function of the heart? What is function of what?
It's to pump blood throughout your body.
So one of the children over there, they raised his hand and he stood up and he very innocently said, "Heart ka kaam, dil ka kaam hota hai dhadakna." So yeah, apart from beating, what it actually does is it pumps the blood all through the system in your body. But it itself also needs blood supply because blood gets what? Oxygen and sugar, glucose to the heart. So if this blood supply is blocked, then what happens? That part of the heart is not getting blood supply. That means it's not getting oxygen. Now, if you can see this, we've heard about 50% blocks, 80%, 70%, 30% blocks. All of you must have heard of this. You go to a cardiologist, somebody in your family has gone to a cardiologist and they've been told it's a 30% block. Chinta karne ki zarurat nahi hai, kuch karna nahi hai. Somebody else has a 90% block and will require a bypass or maybe an angioplasty. So you've all heard of these terminologies, right? Yeah, give me a thumbs up. All of you?
Yes.
All of you here
Yeah.
with me? All right. So we've heard of these blocks, right? So these are, what are these? These are basically arteries. Jisme se blood ja raha hai. The blood is passing through this and reaching the muscle. So if you imagine this, heart is the size of the fist. Each of us, our fist is that's the size of your heart. So if we imagine this to be the heart, now there are three main arteries, the three main blood vessels which bring the blood supply to the heart, which then again bifurcate into branches. They branch out and they become smaller vessels, and each and every cell of your heart is given blood. Okay. Now, one of these three arteries, if it is blocked, what will happen? Say, for example, the left artery is the one that's more generally blocked. So let's say this part of the heart is blocked. What will happen? The remaining heart will keep pumping, but this part of the heart begins to die. Okay, those number of cells which are not getting a blood supply will begin to die. Then what will happen? The person will start experiencing pain. How does he experience pain? How does he? So keep your questions. We'll be taking these questions. If I miss anything, please do ask me again. There are questions in the chat box coming, so we'll take them one by
I'm
one.
keeping a track of it. Yeah.
Yeah. Okay. Thank you. So how will he experience pain? Now, if your hand gets cut, you can actually point and say it's hurting here. Yahan pe dard kar raha hai, aap bata sakte ho. You can actually point to that point where it's hurting and say. But your internal organs. Now, let's say somebody's having somebody got a spectacle. Does the eye hurt? The eye doesn't hurt. Your head aches, right? You get head. Your head aches. You get headaches. If your tooth.
Somebody will need to, mute himself.
I think somebody is not on mute. Could you please mute yourself, please?
Anybody wants to talk elsewhere, please mute.
If you have any questions, if you want to answer something, if you want to say something, please unmute. Till then, I would prefer if you can keep yourselves on the mute so that we don't disturb ourselves and the other people around. Thank you. So how does he experience pain? Now, if your tooth is decaying, you need a root canal, does your tooth actually hurt, or your jaw, your ear, and everything else around hurts? What happens? The surrounding structures hurt, right? So similarly, in heart or any other internal organ, the organ or the actual muscle, the heart does not hurt. Anything that is covering it, your chest wall, your hand, your jaw, your neckline, that will hurt. So how will the patient present? How will the patient tell you? He has this sense of doom. Something is very wrong. He's going to probably die, or the world is coming to an end. Maybe nothing's going to happen to him, but the world is coming to an end. So he has that something called a sense of doom. That's what we say. So somebody having a heart attack will keep repeating, something is wrong, something is not. So he'll keep, convincing himself, acidity hai shayad, dyspepsia hai, indigestion hai. He'll try to convince himself with these things because there is severe pain in the center of the chest. Where is the heart exactly? Heart kahan pe? Left side pe, right side pe, center pe hai? Where is the heart?
Left or center?
Left or center? You have to choose one.
Left off center. Left off center.
Left of center. Okay. All right. Anyone else? How many of you say it's on the left side? How many of you say it's on the left side?
It will be nice if you could just start your video, put your videos on and show us. It will be really nice to.
या फिर आप लोग thumbs up भी दे सकते हो. You can use your thumbs up, so I know you're responding. You're able to actually hear me. You're with me.
You can feel it here. You can just feel it. That's all. You just put your hand
here.
Feel
it on the left side. You can feel it more on the left side because you have a breastbone in the middle obstructing it. Yeah. So where is it? Now Shah Rukh Khan, Amir Khan, and all those people, they can, they hold it on the left side and say "Pyar ho gaya." So everybody thinks, what is it? Everybody thinks that it's on the left side, but that's not how it is. Your movies, your Bollywood movies tell you the wrong anatomy. The heart is in the center, tilted to the left. Okay, the heart is in the center. I'm so sorry. So the heart is in the center, tilted to the left. Now what happens? Any part of the heart which is dying. So most often than not, the left side is the one that gets the heart attack or the blockages. So your left side hurts a lot. So your left side of the arm, your chest wall radiates. The pain radiates. It starts from the chest and goes into the left side of the arm along your little finger. That's the most common presentation. But in India these days, we are seeing very abnormal presentations also. For example, in women, elderly, diabetics, what you get is women who have heart attacks have a very different presentation, because women by nature, we have our periods, we have our menstrual cycles, there is estrogen in the body. So that is generally considered protective to the cardiovascular system. It protects your heart and the brain. But with the kind of lifestyle we are leading these days, we are getting more and more women who are having heart attacks in a younger age group, less than 40. So before this, when I was doing my MBBS, we were taught that it's always above 55 that women will suffer from a heart attack or a stroke. But these days, we're seeing as young as 30 and 35-year-old women who are suffering from these cardiovascular diseases. So how do they present? They present with aches in the chest, discomfort in the chest, heartburn, acidity, indigestion, low back pains. This is very, very vague. The person will constantly tell you something is wrong. They'll try to take antacids, and the person will keep repeating that there is something very abnormal about this. It's not a regular thing that's happening. So what do you do as a first aider? What do you do if you find that somebody's having a heart attack? They can have nausea, they can have vomiting, they can have sweating, and fear.
Nilima, could you please mute yourself?
If you want to answer, you can answer this. What will you do if you find that somebody's having a heart attack? What will you do? Mr. Dibyajit, you want to answer? You've unmuted yourself.
Need a lot of space.
Yes,
space.
Absolutely. So what happens in India? Somebody is going through a emergency. What do? We crowd around them. And we just block out all the air. Yeah, we block out all the air and ventilation. So what do? First and foremost, as a first aider, what do you need to do? You need to be first calm and you need to be collected. You need to be calm or thanda hona chahiye as a first aider. If you want to help someone, the first thing you do is you settle your pulse rate first. All right? What should you do? You first calm yourself down and then you can reassure and calm the person down. So what is your first intention as a first aider in a heart attack? You need to make the person comfortable. It want their pulse rate, their heart to stop, beating fast. It has to beat slowly. So what do you ask them to do? Take a deep breath. Sit in this knee to chest position. This is the position. Everyone can see this position. Give me a thumbs up if you can.
Yes.
Yeah. Okay. So this is the knee chest position. Why is this important? So that your diaphragm is away from the heart. The lungs have a greater space to breathe. And your knee is towards the chest, so your heart doesn't have to work extra to pump the blood to your feet. All the blood can come back. All right. So this is the best posture for a heart disease victim, heart attack victim. A heart attack victim should be transferred. A heart attack victim should be transferred to the cardiologist's place, a cath lab in this position. Don't make them sleep. Don't make them lie down, because then the breathing will get affected. The heart has to work more. So what you need to do is make sure if they're walking, you ask them to sit down. Don't make them walk. The more they walk, the heart will need to pump more. The heart is already, part of the heart is already dying. So you have to make sure their heart is not overworked. So you reassure them, calm them down, open the windows, loosen their shirts, ties, if they're wearing any. If it's a female, then you loosen their blouse. See, first aid, there's no partiality, or there's no discrimination in gender. Gender is always in the bathroom or in the bedroom. Everywhere else, it's a human being. So when you're giving first aid, always remember that this is the most important thing. If it's a woman, you have to loosen their blouse, make sure they're getting enough space to breathe. Their lungs need to expand more. And that's why you give them a knee to chest position. India, the first thing we do is give water to every other situation. We don't give water in this situation. Can anyone tell me why? Tejasvi, you've raised your hand. I'm so sorry, I missed that.
No problem, ma'am. Ma'am, I was just wanting to ask, you have written no physical activity, but it is said that a gastrocnemius stool is a second heart. So what is the role of the movement of the, like, how we give active ankle pumps? So
So
that
gastrocnemius, yeah, so that's the calf muscle you're talking about. So the calf muscle is the second heart. So that's the reason why you give the knee chest position. So it's in a contracted state. Your calf muscle goes into contraction, and what happens? The sinuses will, contract. Whatever blood is pooled inside those sinuses will be pushed back to the heart. So you have a second heart. She's absolutely right. When she's saying the calf muscle is the second heart in the body, the blood pools there. That is the reason why you don't make them sleep or you don't make them stand, because then the blood, because your heart is getting weaker, your blood will pool inside the calf muscles, and that is why you give the knee chest position. So what happens is,
tell them to move a little bit.
No, we don't.
Okay.
Absolutely not. So what happens is, once the minute you realize this is a heart attack, you ask the patient to rest and you give them a very comfortable position and make them less anxious, because they are going to be anxious. Like, they don't know what is happening to them. They feel like they're going to die or something really worse is going to happen. So you calm them down and immediately take them to the hospital, or you call the emergency ambulance number. What is the emergency ambulance number in India? Anyone?
Is it 109? Not sure.
So why should we not? It's 108. It's 108. Okay, 100 is what? 100 is
Police.
100 is police. 101 is, what is 101?
100 is for police.
100 is police. 101 is fire. 108 is your cardiac ambulance. We are coming up with another number, 112, which the government will slowly, eventually release. It's still under work, and the work is in progress. It'll be like the 911 or the 999 of US and UK. So it'll be the single number where all your medical services, police, fire, everything will be, collated together. So they're coming up with that, but there's still time. In the meantime, you should know it's 108, the cardiac ambulance. Okay, it's free of cost across India, and you'll be taken to a government hospital if you don't want to pay for the services. All right, so you need to call 108, or you take the victim, you take the patient of heart attack in this position. Is that clear? Yeah. Okay, so my another question was, do not give water. Why we should not give water? Sangeeta has just written the answer correctly. The patient might aspirate, she says. Anyone has any idea what that means? 102 is not the number for cardiac ambulance, okay? No one knows what is an aspiration. Okay, so what happens is, you don't know whether this heart attack victim is going to stay conscious. He might become unconscious in some time. And what happens when you become unconscious? Can you swallow if the person vomits during the unconsciousness, during the fainting spell? What can the person swallow whatever is there in the mouth?
They may be choking, I think.
Yes, they will choke on that. So what will happen? All of that vomitus or the water or whatever you've given during their awake period, all of that, if that comes out of their stomach, because when they're unconscious, all their reflexes are gone. All of it is gone. So whatever is in the stomach might come out. And where will it go? It will go into the lungs. The person might not die of heart attack, but he will definitely die of choking. So please do not give water during any emergency. It takes 3 days for a person to die of thirst. Okay, it takes 3 days for a person to die of thirst. But if the person does not get oxygen, if you choke if the person chokes on, somebody is not on mute. Can you please mute it, please? Can you please go on mute? Thank you. So if you choke the lungs with fluid or blood or aspirate or whatever, then the person can die within 3 minutes. All right, we'll see why in the when we're discussing CPR. So that's the reason why we do not give water immediately in any emergency, especially if somebody has hit their head, it's a road traffic accident, or it's an emergency where you don't know that person might become unconscious in some time. Low blood sugars, especially the person who's drowsy, he might become unconscious. So if the swallowing is affected, we do not give water. You can wait 20 minutes and then give water once you know everything is fine. The person is not fainting, the person is not becoming unconscious. Uske baad aap de do pani. But till then, please do not give water. One thing that you can do, because if the patient, your heart attack victim, like I've written here, if they are already on medications, their cardiologist would have already told them that this is the medication you take if you get a chest pain. Angina it is called, that chest pain is called angina. So angina agar hua to ye dawai le lo, take this medicine. If that is what has been told, you help them take that medicine with 1 sip of water. All right, you do not give more water. That's what we do in India. Is that okay? Can we move on if there are no questions? Are there any questions? We can go on, move on.
Yes.
Yeah, thumbs up. All right. Okay, can we have this interactive, please? Because I can't keep going back to the chat. It may block the lung. Yes, 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 yes. So you've been answering on the chat box. It would be helpful if you can actually unmute yourself and talk to me in the
Yes, ma'am.
meantime. Yeah, thank you. Okay, so coming to this. Now, we all know what a heart attack is. A heart attack victim can actually tell you what is going on. He will be conscious, alert. But there is something called as cardiac arrest. So what is cardiac arrest? Okay, and this scene, this pictures that you can see could be any one of us in the current stage of time, in the kind of time, time period that we are living in. This could be any one of us, our loved ones, or people standing right next to you on a railway platform or a airport or a bus station. It could happen to anyone. How many of you agree to this? How many of you agree to this? We'll be talking
Yes,
about
right.
mouth-to-mouth
Yeah,
respiration
that's
in a
right.
short while. Yeah, Sharvari, tell me.
Yeah, actually, this is something I lost my husband last year, and that was cardiac arrest, and it was
So sorry, ma'am.
completely he was completely all right, and it was sudden actually. Means we were having discussion, normal discussion, and suddenly he got a chest pain. So it was very difficult for me to understand whether it is a cardiac, it's a kind of arrest. So I gave him limbu pani because I didn't know like whether and then he only told me that take me to a hospital. By the time we reached there, after 2 hours, I lost him.
I'm so sorry, ma'am. I'm really sorry. We truly understand. Trust me, I've worked in the emergency field for many years. The reason we have taken up this cause is so that no one loses their loved ones. CPR and sudden cardiac arrest is something that it's really something that we all can help with. Thank you so much for sharing your story, ma'am. Please take a minute if you want. I truly understand your pain. Trust me, I do. We've lost so many people to cardiac arrest that this is the entire reason why we're so dedicated to this life-saving movement. And thank you for sharing your story. So the reason I talk about cardiac arrest is because in India today, it's a huge, so COVID is a pandemic, but even before this pandemic came, India is now the hub. It is an epidemic. It's a center of epidemic for heart disease and diabetes today. And every second or the third person can have this today. And this is the reason why we're doing this. So all of you, I'm really thankful for all of you to be part of this session today. Because you're joining the life-saving movement, and your contribution and your participation means a lot to us and our work. We'll just see this video once about what is a cardiac arrest, and I'll tell you all about what a cardiac arrest is. So, so kindly let me know if you can see the video. If you're not able to see the video, please let me know. Can you see the video?
Ma'am, it is not on. You can just
Play it.
on it.
All right,
play
all
it.
right, all right. Okay, can you all see the screen now?
Yes.
Yes.
Yeah?
Yes.
Can you hear it?
Sudden cardiac arrest happens when
Yes.
Yeah? All right. Okay. So we are talking about
Yes.
sudden cardiac arrest as against heart attack that we just heard about. Now we'll also talk about where all cardiac arrest can happen. Most often than now in India especially, it is happening to people with heart disease. And that's the reason why we're taking this heart attack with cardiac arrest. But cardiac arrest can happen in so many other different scenarios. We'll talk about that after this video.
Sudden cardiac arrest happens when the normal electrical impulses in the heart unexpectedly become disorganized. The normally coordinated mechanical contraction of the heart muscle is lost, and a chaotic, quivering condition known as ventricular fibrillation can occur. Blood flow to the brain and body abruptly stops. The lack of blood and oxygen to the brain causes the person to quickly lose consciousness, collapse, and stop breathing. Brain tissue is especially sensitive to a lack of oxygen. When oxygen is cut off, brain death can occur quickly, within a matter of minutes. Without early recognition and care from a bystander, the person will not survive. Cardiopulmonary resuscitation, or CPR, allows a bystander to restore some oxygen to the brain through a combination of chest compressions and rescue breaths. By itself, CPR is only a temporary measure that can buy time until more advanced care can be provided.
So what is cardiac arrest? Cardiac arrest is when the heart completely stops. So when you saw the heart attack, the heart was still pumping, only a part of the heart was dying. Here, the entire heart stops pumping and goes into a fibrillatory mode. Yeah, all of you can understand this? If somebody doesn't understand, please raise your hand so that I can explain to everyone. Everyone getting it? Yeah, Mr. Shenoy.
You said now about a fibrillation. So if you can just explain that
I will.
how it is manifested.
I'll tell you. Yeah, Mr. Shenoy, you've raised your hand.
Ventricular. Yeah.
Mr. Shenoy, you've raised your hand. You want to say something?
Please explain difference again.
Yeah, I will. Okay, so what is happening with cardiac arrest is the heart is not pumping, it just stands still. Arrest means stop hona, ruk jana. So heart is not pumping anymore. If you can see my hands, all of you can see my hands, it's not pumping anymore, it just stands still. So it is shaking like this, you know, the entire heart is shaking like this. So whatever blood is coming in just stays there, it doesn't go out. So when the blood doesn't go out, the brain does not get any blood supply. You getting it? Your heart is pumping. In a heart attack, what is happening? Only a part of the heart is dying. The rest of the heart is still pumping, maybe weakly. Thoda weak, thoda uska strength shayad kam hoga pumping ka. But blood is still reaching the brain. The person is still conscious. Okay? The person is still conscious and he can tell you कि मेरा सीना दर्द कर रहा है, उल्टी जैसे लग रहा है, सर दर्द कर रहा है या पसीने छूट रहे हैं. He can tell you different things. In a cardiac arrest, what is happening? The heart is not pumping. The entire heart becomes still. It just stops and it goes into this mode. It is shaking. It is trembling. Like ठंडी लगने के बाद कैसे लगता है? When you feel cold, you start shivering. That's exactly how the heart is. So whatever blood is coming inside the heart stays there. It doesn't go out. So what happens? The brain gets no blood supply. Now your brain is one organ which loves oxygen and sugar, glucose. Okay. Now glucose nahi mila, it can stay for some time. It'll stay alive for some time at least. But with oxygen, it has got special affinity. It's a love story with the brain that it cannot live without oxygen. Really. Love stories may, the boyfriend tells the girlfriend, I cannot live without you, but he does eventually. He or she, even she. Both of them can actually live without each other. They're just saying it. But in this case, the brain cannot live without oxygen at all. How much time it'll take for the brain to start shutting down? 3 to 5 minutes. From 5 to 8 minutes, the brain cells will actually begin to die. Okay, from the 5 minutes to the 8th minute time, 5th minute to the 8th minute, your brain cells begin to die. And this rate of death is different for each person. If my blood supply to the brain got cut off, so my brain cells will begin to die in 5 to 8 minutes time. Okay, in the first 3 minutes, the brain will shut down. But before it shuts down, what happens? The person becomes unconscious. The minute the blood supply is cut off, the minute the heart stands still, blood supply is cut off, the person will fall down unconscious. He will not remain conscious. Do you understand this? Everyone on par with me?
Yes, yes.
Everyone?
Yes,
yeah.
yes,
So what happens with cardiac arrest is the heart stops. There's no blood supply to the brain. The brain so jata hai. The brain will sleep now. And in the next 3 minutes, it starts shutting down its functions. Okay, and in the next 5th to 8th minute, the brain cells begin to die. All right. So what happens? The person will not be breathing, the person will not be conscious, the person will not have any circulation in the body, so the body goes cold. Yeah, Tejasvi.
Ma'am, you said the rate of the brain cell dying will differ person to person.
Yes.
So
Correct.
you can cover the question now or later on. So how does it that differ from person to person, and what are the factors responsible for that?
No, that's different. What we're trying to say is how much part of the brain has suffered hypoxia or no oxygen supply is different. So once you've started CPR, you have got the mental. So why do you give CPR? What you're doing is basically you're becoming the heart and the lungs of this person. Now, why I'm taking this, why we are talking about CPR is because we are going to share a video now which shows the success story where a person who suffered cardiac arrest, there was no blood supply to the brain, but they gave her CPR, they gave her an AED shock, and they brought her back to life. So that's the reason why we're discussing this. Okay, so we are not going to go into the specifics of how much hypoxia affects how much part of the brain. We are interested in the fact that CPR saves lives. Okay, so we'll see this video and then we'll go on ahead. Okay, the reason I share this video is because these are a few of the stories that need to be brought to the forefront. Okay, so in India we don't have many such stories that are being shared on the public platform. These stories need to come to fore is what the reason why we are sharing this. All right, so just give me 1 second and I will share the. Sorry about the technical glitches. Give me just a second. All right, can you all see the screen, please? Yeah, you can all see the screen.
Yes.
Can see.
So this is a 17-year-old girl, Claire, who went to high school volleyball game. Okay, and she goes into a sudden cardiac arrest. Please watch this video.
We had 2 games that night. I was in a lot of pain, which I was used to because I'd been playing in pain the entire season.
You could tell that she was laboring somewhat, but Claire just has the heart of a champion, and she's just going to keep playing.
Well, I was sitting at the scorer's table, keeping score for the game, and I just heard a loud thud.
I think we just started yelling for help.
Yeah, yelling 911. You have a feeling of helplessness.
And it was very quickly that there was people there with us, very quickly.
She fell about right here. Starting back in 2006, our school got the first AED. As part of that training, we would come together and we would have drills unannounced. Because of the code blue drills, there were some things that were just instinctual to me. The AED is literally right outside of those doors. Go grab the AED, bring it back, and get to work.
You really
Terror.
can't describe
Yeah.
just the fear you had going through your mind.
It really looks like they were running a drill, that it was so quickly that people were to Claire and that they were taking care of her, and it was amazing.
She was in VFib, and so the only thing that would bring her heart back into a viable rhythm was to have a shock. The AED was needed in order to bring her back to life.
It's complete joy seeing her revived.
I'm just really thankful, and I feel really blessed that this is where I was chosen to go to school at, and just really thankful.
We know that God created her, and he knew about this moment before it happened, and he knew who would be here and what the outcome would be, and then what we would be responsible to do going forward to share her story. Well, we wouldn't let our child participate in a sport anywhere at this point if there wasn't an AED machine accessible. So waiting until someone's gone is not a good time.
So she's a 17-year-old girl, who got saved, who was rescued because people there were trained in conducting drills in CPR and AED. All right. So how many of us can claim to have information or even know how to do CPR? The reason I say this is because this life-saving movement started with my own selfish interest. Like I initially asked all of you, how many of you know what an anesthesiologist does? Yeah? How many of you know what an anesthesiologist does? Can anyone tell me? An anesthesiologist, behoshi ke doctor? Anyone? You can unmute yourself and tell me. This is the reason I talk about this is very, very important.
They intubate.
They intubate. Okay, intubation ka matlab hota hai, for other people who don't know, we put in a breathing tube inside your lungs and we give you respiration. We help you breathe. That's something we do. Yes. Anything else? The basic everything everyone I think knows, we put you to sleep for any major surgeries. If there is any operation, knock people out. Yeah, absolutely, Shaila. We knock people out completely. So we put you to sleep during a major surgery so that we take your pain away. So basically what we do is we deal with pain management. We help you deal with pain. We take away your pain for any major operation. So either the entire body or parts of your body, which we call as regional anesthesia. So we put parts of your body to sleep or your entire body to sleep and take away your pain. That's one. The second is we have airway management. So we know how to manage your lungs and your breathing and your respiration. We are proficient in that. There is another third very, very important job that we do, and that has to do with emergency care. How many of you know that? How many of you know that we are emergency physicians to other doctors? Yes, Mr. Shanoy, we control monitors and we are responsible for waking people up also after surgery. But the third most important thing that we are proficient and trained in doing is saving people's lives. So in an emergency, especially medical emergency, so we are emergency physicians to all the other specialty of doctors. So when a code blue is called inside the hospital, we are the people out there. In a casualty, anesthesiologists are the consultants. In an emergency room, in an ER, in a casualty, we ICUs, we are the people. So COVID warriors, most of the COVID warriors have been anesthesiologists. So the reason is we have a control, we know how to save lives in an emergency, and we have a control over your airway, your breathing systems. So when I ask you this, I as a doctor inside the hospital, will I be the first responder on the scene for an emergency? Or will I be the last responder on the scene? Will I look at your patient, your victim last or the first person? I'll be the last person, right? How many of you agree with me that you will be the first responder on the scene? Right now I'm at home, so I'm the first responder on the scene. But if I'm in the hospital working, will I be the last person to look at the patient? Yeah, in any emergency. How many of you agree with me? Yeah, Priya,
Yeah,
thank
ma'am,
you for
agree.
letting me know you didn't know this. Okay. Yeah, somebody said something. Who said? Somebody said. All right.
Yeah, ma'am, I told agreed with you.
Mr. Deepak.
Yeah.
Yeah, tell me. I couldn't catch your voice. Please.
Yeah, you would basically be the last person in the hospital. First of all, anesthesiologist will only see the patient, and he or she will give the dose to the patient, due to which the person will go to sleep.
Yes.
And after that, only the surgery will occur.
Yes. So we will be, even in the emergency room, we will be the last person. In the emergency room, we might be the first people to see the patient. But as a emergency response, as an emergency situation on the whole, a doctor will always be the last person in any medical emergency. You who are there in that situation will be the first responder on the scene. So do you really know what is to be done? How it is to be, how the scenario has to be managed? How many of you know what is to be done in any situation? We don't do this in India. In India, there is no conversation on first responder help, first responder skills. We don't talk about first aid. Whatever government, things also come out, advertisements or promotions come out, they have to do with a lot of other things. Money bachao, polio eradication. There's so many other things that the government is busy with. We don't have this in schools. We don't have this in colleges. And unfortunately, even with medical education, we have to go to American Heart Association to learn all of these things, which is an unfortunate situation in India. And that's the reason why we are conducting this life-saving movement. We are undergoing this so that none of you. So I need to share this one small incident that happened with me, and the reason why I've taken this up is I was posted in the casualty, and we had a 7-year-old child coming to us brought dead. Now this child just had a history of epilepsy. He used to have fits, akadi mirgi. So mirki ki bimari thi, and this child had fits and he was brought dead. We didn't know what had happened, and as usual, it's a medico-legal case, so we sent him for post-mortem. Turns out his teeth, he was a 7-year-old child, his teeth were found inside his lungs. The reason is during fits, his parents his father or somebody put a spoon in his mouth so that he doesn't bite his tongue during the fit, during the convulsion, during the seizure. The teeth which were probably falling off, which were loose, broke off, and when he aspirated, he actually swallowed it inside his lungs, and he bled inside and drowned in his own blood. Now, when this happens, we come to know that we don't know any first aid skills at all in India, and we just go by whatever has been passed on from generations to generations. And this is the very huge time. This is a very huge reason why we conduct these life-saving movements. Okay, so this is the list of recent victims of cardiac arrest that has happened. Okay, these are the recent victims of cardiac arrest. All of you know that, and the reason why I've included this is it spares no one. All right. The reason why we talk about cardiac arrest is in India in 2015, 2.1 million deaths happened across all ages. Okay. The reason is in the last 26 years, heart disease has gone up through the roof, and 34% increase in deaths because of heart disease has happened. This has happened mostly in urban, wealthy, educated Indians who are at a higher risk of heart disease. More youth in India are succumbing to heart-related ailments. If you can see these twin towers in between, can you all see this? These two towers in the middle, these are individually Mumbai and Kerala. Individually Mumbai and Kerala, we are surpassing more than half of it, more than double of the entire statistics for USA. USA is a larger country. It's got 50 states. India is a smaller country, more population, but the numbers in individually Mumbai and Kerala are surpassing double the numbers of USA as an entire country as the number of deaths due to cardiovascular disease or heart disease. We are staring at a lifestyle epidemic. The kind of processed foods that we are consuming, the kind of sedentary lifestyle we are leading, and the kind of pollution, no environmental safety, no trees plantation, nothing of that sort is leading to this. We know as a statistical measure that 80% of cardiac arrests happen outside hospitals. 20% outside of these, 20% of these cardiac arrests that happen outside of hospital occur in public places. And we are a country where pizza is delivered earlier than an ambulance. So you all need to know what CPR is. So like we discussed, what is CPR? You become the heart and the lungs of the victim. All right. So we'll see a very short video on how to give CPR to a victim, unconscious victim, and then we'll look at the steps. All right. So far, everyone with me?
Yes.
Yes. Okay.
Would you know what to do if someone suddenly collapsed in front of you? Helping to save a life may be easier than you think. If you see a teen or an adult suddenly collapse, it's important to respond fast. Running away and ignoring it is not an answer. Here's the sequence to respond to a sudden cardiac arrest collapse. As with all first aid situations, you need to assess the risk to your personal safety first, and the safety of the casualty second. If the victim appears unconscious, shake or tap the victim's shoulders and shout,
Hello, are you okay?
If we get no response, the victim is unconscious, and we send for help.
Call an ambulance. Get the AED.
Open the victim's airway by tilting their head back and lifting their chin. If the victim is not breathing or even gasping, start chest compressions right away. When the AED arrives, allow your second rescuer to prepare the AED while you continue compressions, and follow the instructions from the AED when it's ready.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest.
Remember to remove the victim's clothes to expose his or her bare chest before attaching the electrode pads. Tear open the electrode pack and unfold the electrode pads. Once the pads are applied, The AED will automatically analyze the victim's heart rhythm. You should not touch the victim at this point.
Shock advised.
The AED will advise you to perform CPR immediately.
Push harder. Good compressions. Continue compressions.
Continue CPR and using the AED, following its instructions until help arrives. Your actions can help save a life, including the life of someone you know.
So that is how you can actually save somebody's life. So what is CPR? CPR is when you become the pump of the person, because the person's heart pump is now stopped. So now you will compress the heart from outside and give the circulation that the brain needs. So this is the mnemonic you need to remember, doctors ABCD. So what does it mean? The first is, like the video told you, you have to check for danger for yourself and the victim. So if there is any danger, you make sure you are not in danger first. And then you will begin your approach to the victim to help him out. So if he's fallen right in the middle of the road, what will you do? You will take him to the sidewalk, make a human chain, stop the traffic, and then you will start. Second is you will check for response. You will tap the shoulders, shout in both ears, pinch his ears, and check for response. There will be two kinds of responses that you will get. One is either he will mumble, he's just fainted, he's just become unconscious, not unresponsive. He still will give you some sort of a response. He'll either mumble, he'll twitch his, or move his eyes, grimace, or move his fingers, or he'll be breathing. Even if he doesn't give any of these responses, he'll still be breathing. But when will you start CPR, or when will you call for an ambulance? When the person does not give any response. There is no response. He'll lie down there like a dead body. Even if you tap, shout, and pinch his ears, there will be no response whatsoever. Such a thing, you will know that this is a cardiac arrest. No response, no breathing. That means this probably is a cardiac arrest, and you will need to call an ambulance, and then you need to begin CPR. Okay, so what will you do? You will check. Then what will you do? You will now look for ABCs. Okay, now ABCs means you will check for his breathing. Now during COVID times, we do not, we do not teach you to go near the airway of any person, that is the nose and the mouth of the person. You just have to tilt your head and look if the person's chest is breathing or not, chest is moving or not. If the person is breathing, it will be regularly moving. If the person is breathing, you turn them over onto a recovery position. If the person is not breathing and he has been not responsive, you will begin CPR. What is a recovery position? The recovery position is so that the person doesn't aspirate anything that is there in the mouth. So he'll be lying on his back, right? If there's anything there in the mouth, if he's bleeding, if there's a vomitus, or if there's frothing after a convulsion, what you need to do is you need to turn them over into a recovery position. So whatever side you're sitting on, that hand goes up, okay, above the head. The second hand, which is the opposite hand, will fold at the elbow and come to the same side that you're sitting on. The opposite leg will bend at the knee, and then you will turn them over like a log, like a piece of wood. You will turn them over to your side, and this is how you will see them. The side that you're sitting on, this is how the patient will look to you. And if you can see my arrow here, his neck is open, it's not closed. So this neck open will ensure that he can breathe comfortably without obstruction, and whatever is there in the mouth or there might be bleeding, whatever might come in the mouth will now flow down onto the ground, not go inside his lungs. Aspiration will not happen, and that's how you can save this victim. Now, if the person is not responsive at all, you will start compressions. The person is not responsive and not breathing, there's no chest movement at all, you will begin chest compressions. How will you begin chest compressions? You will find the center of the chest. The center of the chest is located at 2 finger space above the point where the rib cage meets. All of you can feel it. All of you can feel in your own rib cage, which meets in the center. There's a point that meets in the center. The rib cage will come and meet in the center. 2 finger space above that would be the center of the chest. Or you can draw a line between the 2 nipples, and the midpoint would be the center. That's where you will place your hands like this. Can you see it's a 90 degree everywhere? Your elbows are straight and not bent. You cannot bend. You will not use your shoulder or elbows to give the chest compression. You will use your entire body weight, and the movement will be at the hip joint. You will move at your hip joint, not at your shoulder, not at your elbow. And you will give compressions with your hand, the heel of your palm placed on the center of the chest. Can you see this? You can take a screenshot if you would like. All right. This is the correct placement of the hands. How do you give compressions? You give compression at the center of the chest, at least 100 to 120. How you can remember easily is 2 compressions every second. That makes it 120 compressions per minute. So 2 compressions per second and 2 inches deep or 5 centimeters deep. It has to go down 5, the chest has to go in 5 centimeters, come out 5 centimeters. That's exactly how you will give chest compressions. All right, and that's the hand placement. Now, somebody was asking about artificial breaths. We do not promote artificial breaths during COVID. The only reason I'm covering this is because in the last session, people wanted me to include artificial breaths, especially if it's a child who has had a cardiac arrest. If a child who has been dehydrated, who has had severe diarrhea, fluid replacement has not happened, that child can go into cardiac arrest. An electrocution, a high voltage electric shock can put the heart into a cardiac arrest. A very low blood glucose can make the person go into a cardiac arrest. So apart from heart disease, there are other reasons that a person can go into a cardiac arrest. So if it's a drowning child, that child will require breaths. And that's the only reason why I'm covering this. But if it's during COVID era, we ask you to do only compressions only. That is 2 compressions per second on the middle of the chest. Okay, how do you give the artificial breaths? You will open the airway, you will tilt the head up like in the picture here. And then you will place your mouth over the mouth of the victim and pinch the nose and blow in for 1 second only. 1 second is not 1 second, it's just 1. So that's the only breath you will give. And you will watch for chest rise. Once the chest rises, you will stop giving the breath and then you will continue chest compressions. 2 such breaths you will give in 10 seconds, not more than 10 seconds. If you cannot deliver breaths in 10 seconds, you will continue chest compressions. CPR cannot be interrupted for more than 10 seconds at any given point in time. Okay, so this is how you give it. If it's a child, then you would rather give 30 chest compressions, 2 breaths. But if it's any other victim, then please, in COVID era, we do not advise you to give breaths, only chest compressions. Is that clear? Yeah. The only way to learn CPR is a hands-on practice. That's the reason why we are not conducting training programs in CPR. We are conducting first aid programs, certification first aid training programs, but not CPR training, because CPR training is an offline process. You have to learn them hands-on, because we get dummies exactly like this, and we teach you the mouth-to-mouth breathing, we teach you the chest compression depths, and you have to achieve that breath, the depths and the rate. How fast and how deep you go is to be practiced on a mannequin, on a dummy. All right, that's the reason why you require hands-on practice. So, summarizing how the chest compressions are given. First and foremost, you have to check for danger. If there is any danger to you, if something happens to you, there will be 2 casualties, 1 more casualty. So there will be more people required to resuscitate even you. So we do not do harm in the process of giving first aid. The first rule of first aid is do no harm. So we do not go into an area without looking for danger. Suppose a person has got high voltage electric shock and fallen down, you will see that you are wearing rubber sole footwear, you've turned the electric mains off, you're holding a wooden thing in your hand and then approaching the victim. You make sure that you do not become another casualty. The second step is responsiveness. You check for response by tapping their shoulders and looking for any response or breathing. If the person is breathing and responsive but unconscious, you turn them over into a recovery position, call for an ambulance and take them to the hospital. If the person is unresponsive, no response whatsoever, and not breathing, you will begin chest compressions. And then you will call also for help, 108. During chest compressions, if it's a child and somebody that it's a child in your own home, then you can actually open the airway and give rescue breaths. But if you're doing chest compressions for an unknown victim, make sure you are you're doing COVID appropriate behavior. You're actually conducting yourself in a COVID appropriate behavior and do not go anywhere near the airway. All right. And how do you give chest compressions? You give 2 compressions per second for till the help arrives. The last part is the AED part. We'll see the video and then I'll tell you what an AED is. Okay, it's just a 1 minute video that we have. Any questions so far? Anyone?
Depends a lot on if the victim.
So the odds of survival in a sudden cardiac arrest for any victim depends on how immediately CPR is given to them. The hypoxia that we were talking about, you know, how much percentage of the brain will die depends on how soon CPR is provided to the victim.
Victims receive immediate CPR and are treated quickly with automated external defibrillators, or AEDs. It is important to know how to perform CPR and use an AED. It could save the life of a friend, family member, or loved one. When cardiac arrest occurs, oxygen-rich blood stops flowing to the brain, lungs, and the rest of the body. Brain cells begin to die within minutes, and sadly, death soon follows. Cardiopulmonary resuscitation, or CPR, a life-saving technique, should be performed immediately, but chest compressions only. The purpose of CPR is to help keep oxygenated blood flowing around the body until medical help arrives. Good CPR can radically improve the chances of survival up to 6 times. Remember, CPR provides oxygen-rich blood to the brain, heart, and vital organs in order to keep it functioning properly. And don't worry about causing any more harm to the victim. The chances that the victim will survive cardiac arrest without compressions is nearly 0. Now here's how to perform chest compressions. Get down on your knees. Place the heel of one hand in the center of the chest. Place and interlace your other hand on top. Position your shoulders directly above your hands, keeping your arms nice and straight. Now push hard and push fast. Based on the latest 2015 International Resuscitation Guidelines, you will need to do this to ensure you are performing good CPR. Compress at a depth of 5 to 6 centimeters. Compress at a rate of 100 to 120 compressions per minute. Pause for no longer than 10 seconds. Ensure full chest recoil.
So this is how we give chest compressions and CPR. All right. So that's to summarize how to give chest compressions. AED is a machine that is an automated external defibrillator, which means an external machine that provides a shock. AED is a machine that anybody and everybody who's trained to use AED can, actually use. So you don't have to be a doctor to actually, you can see those in the movies, right? They give a shock, the person jumps up. So you don't have to be a doctor to do that. An AED helps you give a shock to any cardiac arrest victim when you're providing CPR. And AED is the one that actually brings back the heart. So knowing how to perform AED shocks is also equally important. Yeah. And the most common reason why most people die from a cardiac arrest is because no one nearby knew CPR, or even if they did, they were not confident to do it, or they didn't actually do it. And it's the most unfortunate thing for the victims of cardiac arrest, because sudden cardiac arrest doesn't take time before it becomes a sudden it becomes a sudden cardiac death. So that's coming to the end of the session. Before we jump to questions, there is a small announcement that I'd like to make. We are conducting, online first aid program on June 19th and 20th. Okay, and that's a first aid program that we conduct every month, and that's open to everyone above 12 years of age. And it's a real-time program. It's a certification program. So if anybody is interested, we'll put in the registration link on the chat box in a few minutes, and you can actually join. We have our Facebook and Instagram handles where we are promoting the first aid program. You can join from there as well. Thank you so much for staying back. We are running 5 minutes late. We can start taking questions. People who can stay back, please do. We'll take all of your questions for as long as it takes. Not a problem. Shruti, go ahead. Let me know.
Shruti, we have few questions.
Yeah, let me know. Yeah.
Asmita Fatima, she wants to ask, what is the major cause of heart attack for women in India.
Major
And
cause
there's
of heart
Shivani
attack.
who,
I'm sorry, I lost your voice there.
yeah, major cause of heart attack.
Major cause of
women
heart
in
attack
India.
is heart disease. And heart disease, the cause is lifestyle and genetics, and there are far too many things actually. But heart disease is a major cause of heart attacks. There's nothing more than that I can tell you. Because India is right now a hub. It's an epidemic of diabetes and heart disease right now. So that's the major cause of heart attack. When there is a blockage in the arteries, so what happens is there are cholesterol blocks in the arteries. Cholesterol is not a risk factor for heart disease anymore. The US FDA has taken it out from the cholesterol. In fact, is one of the most essential ingredients of your bloodstream. Cholesterol is a major part of your brain cells, the covering of the brain cells. All of your cells are covered by cholesterol. So cholesterol is actually a very important thing. But cholesterol is also one of the part of the the block that is created in the artery. So the artery gets blocked and the blood supply to the heart the blood supply to the heart reduces. So when you start exerting yourself, the blood demand of the oxygen demand of the heart increases, but blood supply is not reaching because there's a block. Sometimes this plaque or this block, that is the thrombus that we say, मतलब वो एक block होता है. It's like your plumbing thing, your pipes get blocked with kachra. It's something like that. Your arteries or your blood vessels get blocked there. That piece of it gets broken off, and the smaller it goes through the bloodstream into the smaller vessels, and those get blocked. And what happens is that part of the heart doesn't get blood supply, and you get a heart attack. So we actually had a webinar in the past on heart attack as well. We will plan one soon enough to talk only about heart attack. But the major cause of heart attack is bad lifestyle, your genetic family history maybe, and those blocks that are there in the blood vessels which were not picked up during maybe some people used to have pain in the chest area and they've ignored it for many years, and not actually going to doctors and getting your health checkup done every 5 years. Once you're 30, it should be done every 5 years. Once you're 40, it should be done in 3 years. So you should know your health is your responsibility. Do I answer it satisfactorily, or is there something else that you need to know?
Shivani wants to ask, if the person is obese, then how do we identify the center of the chest before we start CPR?
So even if the person is obese, you can actually feel the breastbone. You can actually feel your own breastbone if you hold it here. So even if the person is obese, you can actually feel the chest bone, the breastbone. So you can trace the breastbone to the tip, down below. That's where the rib cage meets. So 2 finger space above that would be the center of the chest. Not a problem there.
I have one question actually, just
Yeah,
again referring back to the incident actually which happened. Normally, is there any, because we are working, as you rightly mentioned, lifestyle is the one reason, and that is the reason for my husband's case as well. Firstly, due to COVID, actually he was completely like not going out, not doing exercises, and having regular meal and sitting for long hours on your computers. So that was a lifestyle that he was carrying for last 7 to 8 months from the COVID situation. But we had done regular checkups, because after certain age you have to have, and in the corporates also you have regular checkups through your corporates. So there actually those reports, whenever we used to consult doctors, so there wasn't any indicative, I mean to say, yes, that certain levels, your lipid profile and everything, certain levels, or cholesterol may be high for that matter, but it wasn't that high wherein some kind of testing was advised or something like that. Now when this incident happened, actually I just discussed this case with my doctor actually, and he said unless and until you go for angiography, actually it's very difficult at times to understand how much blockage do you have, because my husband had got 100% blockage. So I was quite shocked, like how we did not know that he was carrying that blockage and surviving and doing his routine thing. So is there any in the report, is there any indicative range of reports, whether all the different factors wherein doctors should advise us as go for graphy first? Because normally they don't advise. Yeah.
Yeah, I understand this is a very, very natural progression of, question that when we come across heart disease in the family, this is completely valid what you're asking. So let me just break it down to you. Cholesterol is not a risk factor. A higher cholesterol with a poor, so basically cholesterol is not the culprit here. Your metabolism and how you metabolize everything that you eat is a problem. So your metabolism is, completely based on genetics and geography. So we are belonging to a tropical climate. We are in a hot country, and everything that we are following today is from cold countries, from temperate climate zones. So we really need to go back to who we are as people, as human beings on this geography that we belong to. And we've forgotten all of that, one. Second is mainly what is happening with heart disease in India is there's something called as atherosclerosis. What is atherosclerosis literally means is aging of the blood vessels. This aging of blood vessels starts from the birth of the child. Like inside the mother's womb, there are blood vessels which start growing, and with the age, they start aging. This aging is going faster at a much, much faster rate for Indians compared to the Western population because of the kind of climate that we live in, kind of lifestyle we've changed in the last 30 years with processed food, sedentary lifestyle, and the environment. We have gone from a completely agricultural country to a semi-industrial. I don't even know what we are anymore. But largely, we are a famine, drought, prone kind of a subcontinent. So all of this is playing on our blood vessels. Our blood vessels are aging. So at the age of 40, my blood vessels could be somewhere at the age of 60. So this is a normal. So when we said apne dada pardada, your great grandparents who died of old age, they died of cardiac arrest only, but because of an old heart and old vessel disease. But they died at the age of 70, 80, 90, probably more than 100. What is happening to us is this is a faster pace. And in the last 20 years that we are seeing, heart disease is not presenting itself like a typical heart disease. Mr. Shanoy just asked me whether non-obese people can have heart disease. Let me tell you, Heart Association of India gave out statistics in 2017 which said that in India, normal weight range people have higher heart disease compared to obese people, which is the contrast of Western statistics. Western statistics, still people above 40 and obese people are having heart disease. In India, we have 33% earlier heart disease. We have heart disease at the age of 20 in India, 30 in India, compared to Western statistics, which still say 45 and above. In India, normal weight range people are having heart disease compared to obese people. See, it is entirely, the progression of heart disease has to do with the aging of the system. And it's happening faster because in India, fitness levels are zero. Today, we are urban areas especially. In fact, the last spike in 2018 that we saw was rural. The heart disease spike in India was rural because there's a lot of tobacco and a lot of, a lot of addiction that is happening in the rural areas. Tobacco use, alcohol use. In urban areas, we don't have enough areas to exercise. We don't have enough fresh air. We are not planting enough trees. We don't have good quality water, good quality air. We are not having good quality food to eat. All of this together is giving us this weird vague picture, which is not being picked up by tests. And like rightly your cardiologist says, until you do an angiography, you cannot see how much block is there. But trust me, if I don't mean to reduce your pain. I truly understand. But if it means anything, trust me, with people who have had no blocks on angiography have also died of cardiac arrest. In India, heart disease is a major. That's the reason why I say prevention is definitely better than cure. But in the current scenario that we are in India, your cure comes later. Your first aid is so important. You survive, you make the person, you give CPR, you bring the person back to life, and then you work on the heart, you give them angioplasty, you recirculate the blood, and then give them a good, better lifestyle. In India, people who've already got heart disease need first aid when they come across these incidents, because catching heart disease is right now, just you have to keep addressing your symptoms, you keep addressing your health issues, you keep getting checkups done. But it's not 100% foolproof saying that you will pick up a heart disease, you will pick up a block, you will pick up a heart attack before it happens. Doctors are at loss. We've lost 26-year-old physician in 2015, a 32-year-old doctor, another friend of mine. The only thing he complained was of heartburn. The only thing, ECG was normal, troponins, your blood work was normal, everything was normal. 26-year-old, there is no reason for us to even suspect a heart attack.
Right.
And within the next hour, he had an arrest. CPR we gave, but couldn't really revive him, and we lost him in the next 4 hours. So this is how it is in India, and that's the reason why we need to really up our scale, up our trainings for first aid, and become skilled first responders.
And I believe these symptoms may also vary depending upon person to
Absolutely.
person, because in
Yes.
my husband's case, like since he used to log in 3 o'clock in the morning because he used to serve US client altogether.
Yes.
So it was regular his style only 3 o'clock getting up, and that's the reason regular kind of acidity, and every
Yes.
time taking that Eno and all those things. And
Yes.
we never realize that that is not an acidity, that is something related to your heart.
Yes, true.
Yeah. Yeah.
Thank you so much for
Thank you.
sharing your story. Yeah, any other questions, Shruti? 20.
Yes, we do have, and I think we'll take a few more questions, maybe one.
If everybody is okay with staying back for the question answer session, I think we can take session. We can continue. Everybody all right with this? We are, I mean, much into
Yes,
the.
you can
Yeah?
take
Okay,
a
all
minute.
right. Okay. Yeah.
So there's a question from Ravindra that he's retired now a couple of years back, and during his health checkup, his report said that his metabolic age is half of his real age, what we just discussed. And so what are the chances of person like him getting a heart attack? So I think Ravindra, you are too much into thinking and all of this. But
Yeah.
but don't worry.
So see, the thing is, overthinking and anxiety can also lead to higher, stress levels and higher adrenalines, and your higher hormonal status, stress hormones, and then even that can give you a heart attack. So the best way is, what your grandparents followed. A very cool, simple lifestyle, yoga, meditation, good, simple food, simple lifestyle. That I think we really need to go back to who we used to be as a country. Way back before the invasions and all, probably. So I don't know, because overthinking, we recently 2018, I think we lost one of our my husband's mentor, actually, Dr. Rakesh Sinha. If you've heard of him, he's the foremost leading endoscopic surgeon in Mumbai. He was a marathoner. He used to run 48 kilometers. He was a marathoner. He would regularly practice running on Joggers Park, Jogeshwari, and one fine day in the morning, they just found him, just arrested, unconscious, unresponsive. They unfortunately, nobody gave him CPR. By the time he was brought to Holy Angels, the hospital there, they could not revive him. So there's no such thing as a fitness standard benchmark. There's no such thing as poor cardiovascular health. Everything is a spectrum, and you are your best judge. You are the best person to take care of your health. No doctor can guarantee that you will not have a heart attack, and no doctor can tell you that you will have a heart attack. That's impossible. So as long as you're maintaining a healthy lifestyle, as a mental health, physical health, everything, it all encompasses the whole thing. So, and plus the family structure also is very important, which we have lost in the last few years. The kind of family structure and support, and the safety net we used to have, even that is not there. So that affects your mental health as well. So all of this is a large spectrum that we need to probably have a separate session on. So no answer to your question. I'm so sorry.
So I guess, Shruti, we can conclude this session now.
Yeah.
And would
One
like
question
to.
I wanted to ask, if
Yes.
I can, please. So I asked about the non-inflammatory food, ma'am. If we could please talk about on prevention methods.
So we're not taking
And
prevention
exercise
today,
also.
Rajasvi. We were talking about first aid
That's
to
right.
cardiac arrest. So prevention, yeah, we can definitely have another session sometime in the future. So we were planning a cardiac, healthy nutrition based, nutrition prevention kind of a seminar in
Means
the
how
coming
we can
days. We will,
reduce the inflammation of the body or the inflammatory
yes,
process,
yeah, yeah.
and exercise also, because people are doing exercise, but what are the precautions that
Agreed,
how
agreed. But again,
what are the
prevention is
precautions?
something that's a very large topic. We are planning one soon, and we will update you. We have your registration things, and we will update you your details. So I'd again like to bring your attention to the first aid program that we are having. We'll be teaching you basic first aid techniques and skills for all of these following topics. So if you're interested, you can always register with us. We will send you the mail regarding this session, and you can register with us. It's an original cost of the session is 1600, but we are giving it to you only for 500. Both the sessions. It's a 4-hour session. Certification will be like this in this format, and you can always make avail of this opportunity. So we'll be sending you an email. Please look out for an email, and we'd love feedback from all of you. We have a Google page, and we would love it if you can leave a feedback. It'll help us grow. It'll help us correct. Constructive criticism is more than welcome. It'll help us become better at our work. And anything, we've received a lot of suggestions from you regarding what topics you want to learn. So we can have those as well. If there's anything else, we can talk about that.
Just one small question.
Yeah, Hannah, tell me.
Yeah, that's my daughter's name. I'm Garima.
Right.
With her.
Okay. Yeah.
Long ago when I was in standard 6, we had learned CPR, and of course the technique is different now considering the COVID scenario.
Of course.
My question is that whatever impression I have, by God's grace, I've not been in a situation where I don't know whether to be happy about it. I've been able to use it practically. But yes, I had attended a workshop wherein we were taught CPR. My question is that I understand and what I hear and what I've been gathering from these workshops is that when you give those compressions, the pressure has to be almost, you have to break the bone, the rib. Is it so?
No. So that's the subjective description of how much force is required to give a chest compression. You don't actually break a bone. If your placement of your hand is correct, then you don't actually break a bone. But even if you do, so if you're giving it to a young child or maybe an old age person, like above 60, 70, maybe they have osteoporotic or weak bone, very fragile bones, and they might break. But that's not how you give chest compressions, and that's the reason why hands-on is so important. That's the reason why we have always done real-time trainings for CPR. We never did online trainings for CPR. So all of this information is anyways there on YouTube. It's really available. But the reason we're doing this is so that when you have a subjective context when you're talking about, then you will be able to understand it and learn better. So CPR is always a real-time training. So on the mannequin, you actually experience what kind of force is required. If there are any mistakes, you can actually crease them out, and you can actually give high-quality CPR. If you don't give high-quality CPR, it's again futile, really.
Right. Thank you.
Ma'am, if you could please give a mail or a certificate to that of attendance of today's
certificate. A little difficult, but we will send you a mail for the first aid program. There you will definitely, after successful completion, you will be given a certificate, any certificate for now. And a real time.
Today's event.
Yes.
If you could just mail that you have attended, so it will be good to document the time and
definitely. Yeah, sure, that can be done. Thank you.
Yeah, ma'am, I would like to connect with you on the personal
sure. We have given out our numbers, and we'll be sending you an email with the contact details soon, and our social media handles also. We'd love your feedback, your support there. It would go a long way in our work, and us personally as well.
Yeah, ma'am, I work with basically children and older adults. So I work with play therapy when it comes to children. So it starts from right from 6 months. So I believe in that early stimulation, and that is for normal children. and older adults have done my thesis. I was at Scion only for that thesis. Then I started
We can
applying.
connect. We can connect, Tejas.
Yeah.
I'd love to talk to you about science, and it
Sure,
would be
ma'am.
my pleasure.
Yeah.
So, Shaila, yeah, I really do hope
Thank
one day
you.
first aid becomes an everyday topic and an everyday situation in schools and everything. We are looking forward to conducting real-time trainings very soon
That
once
will be
this COVID
helpful.
situation resolves. We are looking for schools, colleges, everywhere. There is no dearth to the places that we would want to conduct first aid. So you can always get in touch with us and let us know. We have a large team. Shruti is part of the team, and she's herself a great, wonderful instructor. She's worked in projects with the Delhi Metro and different corporate organizations. So we are a big team. Just two of us are here today. We have other doctors as well, and we're all dedicated to this life-saving movement. So thank you so much, everyone, to be a part of this session today.
Ma'am, thank you for the initiative. I see
Thank
very
you.
few doctors are coming up, and normal, community people get advantage of getting in touch with them, listening directly from them. It is a
Thank you
first-hand
so
knowledge
much. Thank you.
that you are
Thank you so
giving
much.
out of your experiences. And I love to have more and more doctors coming up and sharing their knowledge and information.
Thank you so much,
Other
Tejasvi.
than learning from anyone who is
So I look forward to having you for the first aid training program.
I will see my schedule and definitely I will
Definitely.
get in touch.
Yeah, sure.
Thank you, ma'am.
Thank you so much, everyone. If there's if there's nothing.
And we look forward to connecting with you on 19th and 20th as well.
Yes.
So if possible, try to share with as many
taken the
as many people
screenshot.
you can share it with.
Yes. I've taken the
Will be really
screenshot
great.
and I have already added on my status.
Oh,
super. Thank you so much. Thank you,
That was
dear.
very quick.
My
That
pleasure.
was really quick, and thanks a ton. And
My
we
pleasure.
conclude
I
and
can understand this part being an organizer myself. Okay, ma'am. Thank you.
all right. Thank you. Stay safe and stay healthy till we meet next.
We look forward to
Thank you,
seeing
ma'am.
all of you soon. Thank you so much.
Bye-bye. Bye.
Bye.
Thank you, ma'am. Bye-bye.
Thank you. Bye. Bye.
Thank you, Garib.